Welcome back to my channel, Watch and Learn with Umaima. Pregnancy myths and facts that may surprise you. A lot happens during the roughly 40 weeks of pregnancy. You may expect some of the changes that occur during this time, but others may seem fascinating or even surprising. As a society, we have countless myths surrounding the no longer misunderstood process of pregnancy and birth. Some of those myths are fun, while others lead to confusion and misunderstanding about our biology. Here are the 12 most common pregnancy myths and the science behind the truth. Myth number 1, you have to eat for two. Eating for two during pregnancy is a myth. In fact, there's no evidence to prove this myth, and overeating can result in maternal weight gain and child obesity. Your baby will get everything they need from you for the first 6 months without you needing any extra calories. Once you get to the last trimester, you may need about 200 extra calories per day. Myth number 2, you can't drink caffeine while pregnant. In the past, pregnant women were advised to abstain from caffeine while pregnant, but recent studies show that moderate amounts are safe, as long as a few precautions are taken. Experts report that pregnant women can safely consume up to 200 milligrams of caffeine a day, equivalent to a 12-ounce cup of coffee each day. Remember that more than 200 milliliters of caffeine a day can increase your risk of a miscarriage, since caffeine can penetrate the placenta barrier, so be careful not to exceed your limit. Caffeine is also present in many sodas and chocolates, so be extra mindful of them as well. Myth number 3, you can't exercise while pregnant. Exercising is a good practice for you, your baby's health, and your mental health. If you worked out before getting pregnant and are accustomed to your routine, continue your exercise program once you've consulted with your healthcare provider. Just avoid any new, strenuous activities like holding your breath, excessive bouncing or stretching, jumping, bouncing, and sudden jerk motions, advanced abdominal moves, and hot environments like hot yoga. Myth number 4, you'll have weird cravings. As widespread as this thought is, it's a myth. Not all pregnant women have strange and urgent cravings, and here's why. Cravings are often triggered by hormonal changes in your body which affect taste and smell. Also, sharp dips and peaks in your blood sugar levels can give you cravings for sugary, comfort foods. But these hormonal and blood sugar variations are different from person to person. Myth number 5, morning sickness is just a morning thing. More than 70% of women experience nausea and/or vomiting during pregnancy. However, this sick feeling isn't limited to morning hours but can occur at any time of day, since it's a result of periodic hormonal changes. Myth number 6, creams and serums can prevent stretch marks. While some creams can help stretch marks fade faster after they appear, no cream can completely prevent stretch marks from surfacing if they're part of your genetic makeup. However, moisturizing your skin can keep it in a supple state and help it recover faster. If you're nervous about stretch marks, your best option is to diligently apply a moisturizer free of toxins 3 times a day throughout your pregnancy. Myth number 7, you can tell the baby's sex during pregnancy. Whether someone told you to check the position of the baby in your tummy, hold a wedding ring over your abdomen and watch in which direction it turns, carrying low, you're having a boy. If your belly is higher up, it's a girl. Or gauge the sex based on how active the baby is, all you've been told. A myth. Myth number 8, heartburn is related to hair growth in babies. There is hardly any evidence of this saying, as it cannot be proved medically. Pregnant women face issues of heartburn which can be due to hormonal imbalance and the growing baby pressing against your stomach. However, it is still not proved that excessive heartburn would mean that the baby will have thick hair. It is a myth.
Myth number 9. The heart rate of a fetus can predict the gender.
Listen carefully to that heart rate and you'll be able to tell the gender of your future baby, right? It's not true. Normal fetal heart rate for all babies in utero ranges from 120 to 160 beats per minute. You'll have to wait for the ultrasound or birth to find out the gender.
Myth number 10. Avoiding fish during pregnancy.
It is one of the famous myths related to the diet of pregnant women. Elder women from later generations think that as fish contains mercury, it can be harmful to the baby. On the contrary, fish must be consumed during pregnancy because it contains various other nutrients like omega fatty acids, proteins, calcium, etc.
Myth number 11. Your face shape and fullness during pregnancy can predict the gender.
You may have heard that if a woman has a full face or acne, she's having a girl. This is false and another old wives' tale. Your face shape and skin condition during pregnancy are influenced by a number of other factors, like diet and genetics. It is also a myth.
Myth number 12. Certain fruits should be avoided as it causes miscarriage. Many believe that foods, such as papayas, dry fruits, pineapples, oranges and curd, can cause miscarriage. This is, however, not true. There is no reason to abstain from these foods. Some people say that pineapple, papaya, and other fruits can cause miscarriage. However, pineapple is considered safe to eat during pregnancy, along with other fruits.
Thank you for watching. Don't forget to subscribe.